Hey everyone, welcome to Skin Sense. I'm your host, Janine Lassant. We're back here at DermDox again. We've been providing you with a lot of new shows this year, and we're happy to have another guest with us. We have Zach Sabaday. He is a physician's assistant here with Dr. Steve Schleicher, and it's good to have you on the program. We hear a lot about you, and we were talking before we started the show that the last time you were on with us, you were interning here.
Absolutely.
How many years ago was that?
That was at least over a year ago at this point.
Oh my goodness. Well, it's COVID, it seems like we lost 2 years.
He grew up very fast.
So here we are talking again about some clinical studies that you can participate in and actually get paid to do so.
Right. And what are clinical studies? Well, they're studies sanctioned by the FDA, okay, and they have to do with new products, whether they're oral, whether injectable, for any number of diseases, okay? There could be psoriasis, could be atopic dermatitis, which is eczema, could be rosacea, when people get this redness of their skin, it could be acne scars, and two that we're going to talk more about today would be, again, acne scars, which are very, very common, and another condition which is very, very uncommon, which is called neurofibromatosis.
Okay. Now, before we get to the clinical studies, some background. When you come in the office, you will most likely see Zach, right? When are you here? And tell us a little bit about what you do here.
So if you're coming in for the studies, you'll most likely see me on a Tuesday or Wednesday. I'm a physician assistant, so I come in and kind of go over what condition we think we have. I'll confirm that before we start the study, because a lot of times different skin conditions can kind of mimic each other.
Oh, okay.
So then we get into it, we go over our informed consent, tell you all about the study, all the important information that you need to know, give you those forms to go with, and then whatever the study protocol calls for, we get right into it.
All right, so the clinical studies, for anyone watching at home, do you need to be a patient here at the DermDox Center?
Well, that's a great question. No, you don't, okay? So if you have a condition that you would qualify for a study, then you have to contact our study coordinator. And yeah, by all means, we try to get everybody in the studies. You don't have to be a patient here. You do have to have the particular condition for which we're doing the study for. But always stay tuned, because we do many, many, many clinical studies. And there are a lot of people know there's a lot of skin diseases out there. So you never know which studies we're doing. You check our website, you call the office, you call Dana Malk, who basically is the clinical supervisor of all the studies, okay? She's what's called a CRA. And she basically is the point person. So to be enrolled in the study, yes, you contact her, and then she will bring him or her, whoever, into the office. I will meet them, Zach will meet them, and Zach's actually our point person from a clinical standpoint, okay? So when we have to do lesion counts, lots of things we have to do with the studies, okay? We have to make sure the patient is responding to the study, doesn't have any reactions to the study medicine. If they have skin lesions, well, we count them every time they come in the study. Sometimes we actually photograph skin lesions as well. And that's primarily what Zach does, okay? So he's an invaluable member of our study team.
All right, we're going to tell you all about the specifics of the clinical study. Again, this is legit. You can get paid to do this and also help with the research of finding some new medications. So stay with us right here. You're watching Skin Sense on SSP TV. Hi everyone, welcome back to Skin Sense here on SSP TV. If you're just tuning in, we are here at DermDox and we are talking about a clinical study that we are looking for some people to participate with. And the study, there are some particulars of the skin, is it a disease or skin disorder that you need?
The first study, yeah, it's acne. And of course, everybody's heard of acne.
Yes.
All right. 3 out of every 4 teenagers has acne to some degree. I'm sure when you were young, you probably had a couple of pimples now and then, okay? And we always tell people, if you have pimples, don't pop them, all right? Because acne can leave scars. And once you get scars, they're kind of permanent.
Okay.
So, and some people, they get scars no matter what. Some people have very, very bad acne. And unless you treat it very aggressively from the beginning, you may be left with these little, what's called ice pick scars, or you may be left with wider scars. So that's one of the reasons why we get aggressive when we see a person with acne. You know, obviously with teenagers, it's no fun socially because you're laughed at, made fun of, always got pimples and whatever. So, you know, from a psychosocial standpoint, you know, it's not a great thing to have. But the fact that it can leave scars that can be with you for the rest of your life, well, then that's another good reason to get it treated. But right now, we're actually doing a study with a medicated gel to see if that will help those individuals who have scars already.
Okay, so we're looking for someone with scars or with the actual acne or both?
No, right now we're looking for scars.
Okay.
Okay.
Now, can the scars be, some people, you know, it cleared up on their face, but they might have it on their neck.
Right. This study is mainly a facial study.
Okay, so if you have any scarring
So-
on your face from acne, and it can be any age?
So we're looking for patients that are above 18, but younger than, I believe, 35.
Oh, okay.
Okay,
So 18 to 35.
that's
Right,
correct.
and you have to have a certain amount of scars to qualify, right?
Yeah,
So,
you have to have at least 10 scars, and it should be a similar number on both sides of the face. One side can't be more affected than the other, at least not significantly. Of course, your face isn't always going to be symmetrical like that, but
Right.
for the most part.
And is this male, female? Is it a certain group of people?
It's for males, females. If you are a female, you cannot be pregnant during this study. So if you're trying to get pregnant or are, you wouldn't qualify.
Any nationality?
Any nationality. Yep.
Okay. Specifically, Doc, does acne affect a certain group more than others?
that's a good question. And not really. It's just the more dark skinned you are, the greater the chance that acne is going to heal with this hyperpigmentation, these dark areas. So that's disfiguring also. And that's another reason why we like to institute treatment very, very soon, especially say on African Americans, Indians, whoever has dark complected skin. Yeah, you want to make sure you're treated.
Now, we mentioned acne and we're talking about the clinical study. However, if you are at home, maybe you're a parent or you are maybe you're a teenager and you have acne, why is it so important to, you know, not just use something over the counter, but actually to get treatment or to be seen by a dermatologist?
Well, basically, you start with an over-the-counter treatment. Okay, sometimes they work very, very well.
Okay.
Okay, but if they don't, well, then you want to get to a dermatologist. Okay, because you've done everything you can do at home, and you don't want the acne to get worse, and you don't want it to leave scars. Okay, and then speaking about scarring, how many the patients come in? How often?
You come in once a month. You're compensated for your visit. You know, the inconvenience of travel and coming in, so you get $100 for that. And we monitor how our lesions are looking, if they're improving. We use a flashlight to kind of see the depth of them and record that, and the drug companies that monitor it are able to look at those statistics and tell if you're seeing improvement.
And what's the privacy along with that?
What is
Like,
the-
what are they signing themselves if someone comes in and maybe they're a little hesitant because they don't, like, what's their privacy? Is this something that their pictures are and names are going to be seen somewhere? Is it only the pictures? How does that work with the privacy part of it?
Well, we're very strict with the privacy part. Okay, it's anything mandated by the FDA. I mean, analogy would be keeping things under lock and key. Okay, but of course we use computers now. But yeah, I mean, usually what we do is we take close-ups of the lesions, so that's certainly not identifiable. And if we do take patients' full faces, it's only part of the study. It's not even part of our practice. Okay, and that's strictly controlled by both the drug company who's doing the study and by the FDA as well.
Okay, and then how long, for people that might be interested, how long are they a part of this study?
So you're a part of this study for 8 months, and then at 9 months there's a follow-up appointment to conclude the study and see how we did.
Nice. Now, are they using it on just one side of their face, or how does the study work?
So it is a half-sided study here where you're going to get 2 tubes of medication, and 1 tube will have actual medication and the other one will be placebo. So that kind of evens it out so that you're not seeing different skin types, and you can't really compare, one person to another because everybody's skin is unique. But if you're using the same subject and using a different cream on the same face, that'll show if we're going to see significant improvement from a placebo product.
Yeah, and let me just emphasize too, not only does the patient get paid $100 every time they come in and get their picture taken or the sites measured, but they get free medication as well, okay, throughout the whole study.
Wow.
Okay, so that's what's great about clinical trials, that you don't pay for the medicine and you get paid for using it.
Now, if the cream does work and they are part of the clinical study, could they continue using it then on the other side of their face, or how does that work?
That's a really good question, and it really depends on the clinical study, okay? Because a lot of these things haven't been approved yet. It just so happens that, the one we're using for acne, we can get the patients after the study is done. So if it's working, you could continue using it, yeah.
Yeah, because you'd have one side of your face cleared up and be all excited, and then you'd have the other side that I'd have to just sit on this side, right? You'd have to show just one side of your face until you were able to get the...
Or just wear a mask and you couldn't tell anyone.
There you go. You're right. So that's another good point with the maskne, is it called now? Is that similar to, are you seeing more patients come in because, and we did a whole show on this, but we're still wearing these masks, and I don't think there's any end in sight with that. Most people will continue to wear it at some point during the day. Right.
Right.
Some people do break out from wearing masks. There's no doubt about it. So, and masks are going to be around for a while. So, if you go online, you can read about the importance of changing masks. If you continue to wear masks, you want to make sure it's a clean mask. There are ways of actually reusing masks. Okay, that can be done. But other than that, you want to obviously cleanse your face at least a couple of times a day, because people wearing masks is something new for everybody. So, and it doesn't help if you have acne and you have to wear a mask.
Right, you put them down, they gather bacteria, you put that back on your face, and you're creating a perfect little storm there to potentially cause outbreaks. And also be wary of the products that are in your masks, because certain people could be sensitive to the metals that are in those little nose pieces, or maybe even some of the fabrics or the elastics. So,
or you wear makeup, or you're on TV and your makeup is on the mask, and then you're changing your mask 3 or 4 times a day because the mask is carrying all that. You basically have all your makeup getting onto that mask for the women and men who wear makeup. Even I know these kids in school, they come home and make sure you're washing your masks if they're cloth. Some kids are wearing certain masks, and I'm always on my kids to wash those cloth masks. When we come back again, we're talking about this clinical study that deals with acne scarring. So stay with us right here on Skin Sense. And we're back here on Skin Sense talking about clinical studies that you can actually be paid for. You might have free time now in COVID. Maybe you're working from home and you have some time to take part and actually help with development of new medications. We're here at DermDox, and we are talking about these clinical studies. Zach and Dr. Steve talked about the acne scarring clinical study that we're doing, and there's another clinical study that you might know someone or yourself that can participate.
Right, and the condition is called neurofibromatosis. It's a mouthful.
Yes, it is. That's why I made you say it.
And it affects maybe 1 out of every 3,000 individuals. People can look it up on the web, but it's pretty characteristic when you have it. You develop these nodules, some people call them tumors, okay, basically all over your body. And it can be a very, very disfiguring disease. It's genetic in the fact, we call it, it's fancy terminology, but we call it an autosomal dominant trait. which means basically if your mom or your dad carries a trait, they won't have the disease, but they can pass it on to 50% of their kids. Okay, and I think now in the study we have 2 brothers who have this condition. Okay, so parents can be normal, but you can have kids with it. And there's another, we hear all about mutations now with COVID. And some cases of neurofibromatosis just happen, nothing to do with your parents. Your chromosome somehow gets a little bit messed up and your gene gets altered. And what that gene, I don't want to get too technical, but what that gene codes for is how your skin actually reacts, okay? So if you mess up that gene, your skin doesn't react like it should, and you start forming these, it's basically tumors composed of nerve tissue.
So are these benign tumors, or like are they tumors that stick up?
Yeah, they stick up. They are 99.9% they are benign. And actually there are other forms of neurofibromatosis that are much less frequently seen, and some of those have a greater chance of becoming malignant. Okay, but they're very, very rare, that type. The ones that we're doing the study on is the most common form.
So tell us about the specifics. Again, we are looking for people to come in to participate in this clinical study.
All right, so again, we're looking for patients who are above the age of 18, males and females. If you're a female, again, we don't want you thinking about becoming pregnant, or if you are actively pregnant, you wouldn't qualify. And this would be a gel medication that you apply once daily, so pretty simple treatment there. And you just apply it to at least 10 lesions. You need to have 10, at least 2 being on the face and 8 on either the trunk or arms.
Okay, and how often do they come in, or how long does the clinical study last?
So this clinical study will go on for 7 months. The 7th month is the follow-up. You only apply the medication for 6 months. And let's see,
How often do you come in?
You'll come in once monthly.
Okay,
Sorry
not bad.
about that. Once monthly, and you get $100 for each visit.
And you also get the medication.
And you get the medication. And I might add, there's no effective treatment for this condition.
Wow.
Okay, so this is really the first. And we're all hoping that it works, because the other alternative is you cut out the tumors that are really bothering people. We cut out, okay. But we see people can have hundreds of these.
Wow.
Yeah, hundreds. And besides the cosmetic embarrassment it causes, some of these things can be, on your belt line they'll get irritated, on your neckline they'll get irritated. Those we cut out, okay. But now, we're so keeping our fingers crossed that this will work and help shrink down these tumors. It's going to be marvelous.
So when new medication comes out, what is the process of these clinical studies? Does the federal government give guidelines before these can be approved?
Right, which is a great question. So when a new medicine comes out, you do limited testing. And the reason why you do that is basically to make sure it's safe. Okay, and then many times you like to know what dose you can use. Okay, so you'll start with different doses, and in the beginning you'll try different doses on different individuals to see how they react. But the main thing is safety, because obviously you want a product that's safe. Okay, and then from there we recruit, or I should say the drug companies, and recruit more patients to do a bigger study. They all have phases: phase 1, phase 2, and then phase 3, and then phase 4. But basically, the higher the number of phases, the more patients that are involved. Okay, and again, you're looking for both effectiveness and you're looking for safety.
So you can be part of something that is life-changing, and again, there is no medication right now that treats this.
Right, this is totally unique. And the fact that it's a gel as opposed to, say, a pill. Many of the stuff we test you have to inject, okay, under the skin. But this is so simple to use, and it's so simple for us to monitor. Zach, tell them what the monitoring entails when they come in.
Yeah, so with the monitoring, we measure the lesions. They have to fall between a certain millimeter requirement. It's about the size of a marble. So we're making sure that they're getting smaller. Hopefully, if you're on the medication, that's the goal of the treatment. So we'll take those measurements, we'll take pictures as well. That's required for the study, so if you don't consent to having your picture taken, again, you won't qualify. But we'll take pictures of all the lesions up close and from a distance so that we're getting all the data that we need. It's easy to compare it down the road.
So when these clinical studies are done, so this goes on for 7 months, how long does it take to gather the information? And then the people that partake in the study, are they like privy to knowing what the results were?
Yeah, that's a really, really good question. Okay, and actually the study results are confidential. Okay, they're really, we see what drug companies do. It's not just our site. It could be 20 sites across the country.
Darn it, I want to know what the results of that study say.
Right, so yeah, and basically when the study is done, then all that data, okay, is basically gone over by the drug company to see if the medication actually worked. Okay, that's really the only way. I mean, if you have 20 patients, it's very difficult to judge. But if you're doing a national study and you have, say, 700 patients or 1,200 patients, well then, yeah, you could judge whether that medicine is working.
So this could be going on across the nation.
Clinical studies go on across the nation.
So they take all the information from the 20 people you have, all these dermatological centers have, and they collect the data.
Correct.
And then you can see the medicine that you first used that nobody used.
Right.
Into the public. That's kind of cool.
It's kind of cool.
And you get paid.
But I have to say that many patients know. See, a lot of times when we do studies, you'll get either the active ingredient or you'll get what's called a placebo, which means it looks just like the active but doesn't have the active ingredients. Well, if you're a patient and say psoriasis, and you're on the study medicine and your psoriasis clear, it's not going to clear up unless you have the active medication. So then we kind of know, and the patients kind of know that, yeah, I think I do have the active drug because I'm clear.
Yeah.
So, you know, but with what's called a placebo, the chance of you clearing up or getting better, not too good.
That would be a magic pill or a magic drug if that happened.
Well, yeah. Well, placebos have an effect. You know, whenever we do clinical studies, some patients in the placebo group actually do better, and it could be psychological. You know what I mean?
But mind over matter.
Stress, I guess.
Yeah.
So if someone again wants to partake, or you're even thinking about it again, you need to be 18 years or older. You can connect with the number and information on the screen, get more information about the clinical study if you want to call. And then when does this start? Or is it in the process of you're already starting it?
It's ongoing and we're still recruiting patients. So, you know, if you're interested, I would definitely make the call soon so that we get you in before the deadline is up.
Very nice.
And we actually have a gentleman from Florida who's flying up to be in the study.
Really?
Yeah. So we're real excited about it.
Well, that's a good point. If you are watching us online, if you're watching us in a different part of the state or of the country, you're more than welcome to partake in the study because this is going on across the globe.
Correct. Again, get in touch with Dana Mock, and she's the clinical supervisor, and she will, by all means, if you qualify, we will get you in a study.
Very good. Zach, nice to see you.
Always great to see you.
As an official employee here.
Right.
Working with this one.
So happy to be here.
This show is so serious. I have to add.
At the rate we're going, he'll be my replacement. So.
Well, anyway, it was nice seeing you both. And again, if you want any information on the clinical studies, just give Dana a call. And thanks for watching us here again on Skin Sense. We will see you next time.